I know that many of you are wondering how to speak with your children about the current situation we're facing. Concern over the coronavirus can make children and families anxious. It's very important to remember that children look to adults for guidance on how to react to stressful events. If parents seem overly worried, children's anxiety may rise. Parents should reassure children that government, health, and school officials are working very hard to ensure that people throughout the country stay healthy. However, children also need factual, age-appropriate information about the potential seriousness of the disease, its risks, and concrete instructions about how to avoid infections and spread of this disease. Teaching your children positive, preventive measures, talking with them about their fears, and giving them a sense of some control over their risk of infection can help reduce anxiety. Remain calm and reassuring. Children will react to and follow your verbal and nonverbal reactions. What you say and do about COVID-19, current prevention efforts, and related events can either increase or decrease your child's anxiety. If true, emphasize to your children that they and your family are fine. Remind them that you and other adults are there to keep them safe and healthy. Let your children talk about their feelings and help reframe their concerns into the appropriate perspective. Make yourself available. Children need extra attention from you, and they may want to talk to you about their concerns, their fears, and their questions. It's important that they know that they have someone who will listen to them, so make time to tell them, and then tell them that you love them and give them a lot of attention. Avoid excessive blaming. When tensions are high, sometimes we try to blame someone. It's important to avoid stereotyping any one group of people as responsible for this virus. And be aware of any comments that other adults are having around your family. You may have to explain what comments mean if they're different from the values you have at home. Limit television viewing or access to information on the internet and social media. Try to avoid watching or listening to information that might be upsetting when your children are present. Speak to your child about how many stories about the disease might be based on rumors or inaccurate information. Talk to your child about actual facts. Keep to a regular schedule and encourage your children to keep up with schoolwork if possible. Be honest and accurate. In the absence of factual information, children often imagine situations far worse than reality. Don't ignore their concerns. Give them facts. You can tell them how it spread, and that it spread between close contact with an infected person through a cough or a sneeze. Know the symptoms: fever, cough, shortness of breath. Review and model basic hygiene and healthy lifestyle practices for protection. Encourage your children to practice good hygiene every day. Simple steps to prevent the spread of the illness, like washing your hands for at least 20 seconds. Cover their mouths with a tissue when they sneeze or cough, and throw the tissue away immediately. Or cough and sneeze into the bend of your elbow if a tissue is not available. Do not share food or drinks. Giving guidance to children on what they can do to prevent the infection gives them a greater sense of control over disease spread and helps to reduce their anxiety. Encourage healthy habits like balanced meals, plenty of sleep, regular exercise, and explain to them how these all help to keep their immune system strong. Keep explanations age appropriate. Early elementary children need brief, simple information while reassuring them that the adults are there to keep them healthy and to take care of them. Upper elementary and early middle school children, they're going to be more vocal, and they may need more assistance separating reality from rumor. Upper middle school and high school students are able to discuss the issues in a more in-depth, adult-like fashion. I hope this information helps all of you parents out there. And we will also post a list of recommended websites to keep you updated on the current information.